Welcome to a layman's introduction to psych. The aim of this is to answer some basic questions that should hopefully help us have a good groundwork to approach psych from afterwards. Today I want to answer two specific questions. Firstly, what is the DSM and what is a disorder? And I'm going to start with the second one. To understand exactly what a disorder is, let's look at a random fellow named Bill. Now, Bill is a medical student. He is under a lot of pressure. You could say he's stressed, but he's stressed when he needs to study, and he seems to do okay the rest of the time. Let's compare Bill with Sally. So, Sally is also a medical student, but she finds that she is constantly stressed all the time. In fact, she is so stressed that she can't get her work done because she's so stressed to get her work done. When she goes for an interview, she is so stressed that she can't actually perform on the interview. She panics and cancels the interview, or can't actually make it through the interview because she runs out of the room. Something wild like that. Now, that's a bit of an extreme example, but I hope that the key point that we can make here is that everyone gets a little bit of anxiety. Or everyone has some levels of stress. How do we decide when is that stress a disorder? Now, if you're looking for an easy answer, you might say this is where the DSM comes in. The DSM would give us clear criteria to decide whether or not someone has a disorder. For instance, let's look at the DSM-5's criteria for generalized anxiety disorder. As you can see here, there's essentially a list. They need to have excessive anxiety and worry occurring on certain days. They need to find it difficult to control the worry, and they need to have a couple of extra symptoms down the bottom that are associated with the worry, being irritable, difficulty concentrating, that kind of thing. Now, this is extremely useful in that it helps a psychiatrist know exactly what they're talking about when they say someone has generalized anxiety disorder. If you know these criteria and you tell a fellow psychiatrist that they have generalized anxiety disorder, that fellow psychiatrist knows exactly what they're talking about. They know exactly what kind of things they've seen in this person. But it might not necessarily sum up the person's case at all. Let's go look at Sally again. Suppose Sally has these features of, let's say that she's restless and she feels on edge, and she also finds it difficult to concentrate. But she doesn't feel fatigued, she's not irritable, she doesn't have muscle tension, and she's actually sleeping just fine. Now, according to the DSM, she's fine. She does not have generalized anxiety disorder. But if you sat down and spoke to her and you actually realized that this disorder was making it extremely difficult for her to get things done in life, you would say that there is probably something up that needs a bit of help, even though she doesn't follow the strict DSM-5 criteria. So that's the really important thing with the DSM-5, or any of the diagnostic manuals, not just the DSM-5. The DSM-5 is just the current one we're using. They help give us clear criteria to know what we're talking about. But just because someone falls into the DSM-5 criteria doesn't mean that perfectly sums up what they have. And just because they don't fall exactly into the criteria doesn't mean they don't have an issue that requires help. Therefore, every human should be treated as an exact individual. The DSM attempts to take a scale of stress or anxiety throughout the day from 1 to 10. And it says, well, if your stress is more than 8, you probably have a problem. And that's fair enough. And then it says, here's where you now have generalized anxiety. However, if Sally is over here, does that mean she doesn't have a problem? Not necessarily. And by keeping that in mind, it helps you understand what the DSM means, but also that it is not the be-all and end-all for diagnosing something. In fact, as a bunch of med students, most of us probably fall along this line. And it's very easy for us to be close to the generalized anxiety cutoff, or a bit lower off. But every human is going to be somewhere along this. It's not a simple case of some people having 0 anxiety and then some people having 10 anxiety and therefore they have anxiety disorder. And that's part of the difficulty of putting certain disorders in certain categories like generalized anxiety, when in reality it's more like drawing an arbitrary line in the sand at some point and saying, this is where we're going to start calling it. Despite that, we should be well aware of the fact that there's a huge group of people just below that line that still need help, or that someone might actually fall into that category according to DSM, but not be that badly off. However, the categories are designed to kind of really spot when someone is in a lot of trouble. This might leave you a little bit worried, because then how are we supposed to decide who needs treatment, who doesn't, who has anxiety, who doesn't, if even our so-called criteria is actually not that useful? In reality, it's actually quite simple. We can decide whether or not someone needs help based on whether we feel they are impaired or distressed. This is the simplest way to tell whether something is actually a problem in someone's life or whether it's just a part of being human, as sort of stress and sadness and all those things are. If someone is sad, that doesn't mean they have depression. But if someone is so sad for so long that they're unable to look after themselves, they're unable to eat and work, then we would say they have become impaired, and then it's a disorder. If someone is stressed, that's normal. If someone is so stressed they can't look after themselves, they can't work, once again, they're impaired, and therefore it becomes a disorder. So perhaps the easiest way to know whether someone has a psychological disorder worth worrying about is to ask whether it's impacting their life or the lives of people around them in a negative way. Now, today we learned about eating disorder, and I'm sure you'll agree with those as they said that these people will often say that they don't need help. So it's not as simple as just asking whether or not they think it's bothering them, but really taking a look and seeing whether this behavior is negatively impacting them. And if you can say yes it is, then that means it's something that we could probably try and work on. That's it for a brief intro to psych. I hope this at least helps elucidate a bit of the confusion as to what is the DSM, how do we use it, how do we decide if someone has a disorder. Of course, I'm not an expert. This is just my best opinion and hope to clarify that area. Cool. Thank you.